All right, welcome to Tuesday, March 17th. Happy St. Patrick's Day. The Hopkinton Select Board will call the meeting to order. We will start by our standing for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Great. Are we going? Are we going? Okay, usually it shows on there. We will start our meeting with the public forum. Are there any residents that would like to share their ideas, opinions, or ask questions regarding the town government?
And there's a number that people can call and nobody has called.
Okay, all right. So I am closing public forum. Public forum is over, so there's no need to call now. We are, as a select board, you will notice that we have only 3 people here. We did this purposefully because of the COVID-19 virus and the spacing that is required out there to try to limit any type of exposure to any type of virus. So this was Mary Jo and Mr. Catino. Neither one of them couldn't make it. They both could, but as a chair, I decided to have them both stay home. With the virus making the older you get, the more susceptible you are to it, that left Mary Jo and Mr. Catino out, since they are not the youngest 3 on the board. So, that said, we have Sean here in front of us, and he will give us an update, as well as Chief Slamman from the Emergency Management Committee there. They will give us an update on the COVID-19 virus. Welcome. Thank you for braving the elements and coming up. I know, Sean, I know that you've had a very slow couple of weeks, not much going on in the office. So, thank you. So we'd like to hear from both of you, but one at a time.
All right, that's perfect. So, we've got a lot going on. So what I did was I prepared a little summary. So the Hopkinton Health Department is actively monitoring 25 residents. 3 are confirmed COVID-19 cases, and 22 are under direct supervision of the department. Our team continues to implement mitigation strategies to reduce the transmission of COVID-19 in the community. Currently in Hopkinton, we do not have evidence of community spread. I'd like to attribute this to, my public health nurse and the efforts of my school nurses, where we've actually linked every every case in town to either close contact or an international travel. So, it was a tremendous effort to pull all that together. Our mitigation strategy is designed to slow and spread the disease within the community. We're focused on protecting the most vulnerable population, preserving the public safety and healthcare workforce, and to minimize the social and economic impacts of COVID-19. Individuals, businesses, and the community are all part of this mitigation strategy. We provide daily case management, disease surveillance, health education, and implementation of the greater public health guidelines. Our team completes a case and contact assessment for every suspect case that comes into the office, regardless of the risk level. We then direct those individuals to take no action because we've identified no risk. We actively monitor them. We put them into quarantine, or we put them into isolation depending on their exposure and/or symptoms. At this stage, in order for our efforts to be effective, we need the residents of Hopkinton to acknowledge that it is their personal responsibility to implement the recommended personal level actions. These actions are fairly simple. They include practicing effective hand washing, demonstrating proper cough etiquette, and following social distancing guidelines. We need the residents of Hopkinton to be familiar with the COVID-19 symptoms, specifically a fever, a cough, and chest tightness. Other symptoms may be similar to a flu or a mild cold. If you're sick, we just ask you to stay home. Every resident in Hopkinton should create a household action plan for the family and review the emergency action plans for schools and the workplace. We're just asking everybody to be familiar with everything that's going on and all of the efforts that our municipal officials are taking the time to put together. You should have your primary care physician's number available and just know what hospital they're affiliated with. If you were to exhibit any symptoms, you should contact your primary care physician first and then the health department for further assistance. Right now, what we're doing is we're helping coordinate. If people need testing, we're helping them. We're providing almost like a cafe system where we're getting them scheduled into into testing, and providing them all of the information and all the assistance that they might need to navigate the process, and it can be fairly extensive. And then there's new information about COVID-19 that's released almost daily. Because this is a novel strain, it is in many ways very challenging to control and manage, given the vast majority of the population that contracts it will only experience very mild symptoms. We are less concerned about how many people will contract COVID-19 and more concerned about who will contract COVID-19. We hope our strategy, combined with the efforts, will reduce the detrimental effects of COVID-19 in Hopkinton. I'd like to acknowledge all of the departments and their efforts. We're in a much better position because of this collaborative work that we have in place. And, any questions? It's been
Board? The board have any questions?
I do.
Mr. Herr?
Sean, you mentioned the term direct supervision of the Board of Health Department. Meaning folks in town, 23 are under the direct supervision of the Board of Health Department, and the 22, and the other 3, I assume, are under direct care of their doctors.
all of them, all 25 are under direct supervision of our office.
Okay.
So they check in every morning and every afternoon with a list of their symptoms. We collect all that typically by text. If there are any new developments, we have discussions with them. And then if we feel that there's a warrant for further action, we help facilitate contact with their primary care physician, or if necessary with the hospital, and we help get them to the hospital and with proper notification to the hospital that they're moving towards.
And it's my understanding the state regulations require this check-in with you on a daily basis.
Yes.
In other words, this is state law that requires residents of Hopkinton cooperate with the Department of Public Health through this process, correct?
Yes, correct.
Yeah, I think that's important for people to understand. I explain it to my kids, like, guys, if one of us gets this, we kind of surrender ourselves to the rest of the world here to make sure everyone knows what's going on in everyone's household. So I just wanted to bring that up, that it is a regulated process that we all have to cooperate. Second question, is everybody cooperating as you would expect?
Everybody is cooperating, yes.
Okay, excellent. That's great to hear, and that's great for Hopkinton. I'm glad that Hopkinton is doing what we need to do. So just an observation then, Mr. Chair, if I could, not a question so much, at least for right now. I went for a jog earlier. Every time I saw somebody coming at me walking, I went out into the street to get away from them, just keep my distance from everybody. But it was like a ghost town in Hopkinton at 4 o'clock this afternoon. So the residents of Hopkinton, my kids, their friends, the people we know in town, obviously, a lot of people, everyone's taking this very seriously. And that's great to see. It's a little scary. We get it. Everybody feels the same thing. Everybody feels that anxiety. But if we all continue in our little world here, and at the state level, at the national level, all will be good, and we'll get through this. But I'm really heartened to see the residents of Hopkinton taking the social distancing seriously. That, from all accounts on all the various news media outlets, that is the way that we're going to control this virus and get to the other side of this at some point soon. So I just think it's been great to watch how seriously we are as a community taking it. And I know you and Casey and others have been busting your butt for many days now, and we really appreciate your guidance and leadership in this process.
And what we wanted to communicate was that if people have questions, you know, they should feel free to give us a call, because we're at a point now where we're managing our cases, we're evaluating new communication strategies, how to implement these strategies, and we do have time to sit and discuss. You know, Casey tends to handle the clinical side, and I've been handling the policy side. So, like I've been in discussion with daycares, with retail outlets, with restaurants on how to better implement and better manage the takeout policy. So, you know, that's our job, and Casey as a resident has a vested interest in this community, and I've got a lot of friends and family in this community, so it's personal. So,
Great.
we
Thank
want-
you.
yeah.
Thank you. So Sean, I will jump in next. I appreciate all the information forthcoming from your department every day, whether it be at the selectman level or at the general mail distribution level or Facebook level or whatever level it is. It's nice that you're presenting real live factual data that's not speculative, it's not sensationalizing anything, it's just meat and potatoes, exactly what I think we need to hear on a daily basis, giving the updates. The one, building off Mr. Herr's point, really the one good thing about that I've found about Facebook is it's actually, it's like almost like they're shaming anyone that they see at a basketball court or at the tennis courts or at the Little League field or walking downtown or in the Common or sneezing within 50 feet of Mr. Herr. It's nice that it's almost like the people are more afraid of being shamed on Facebook than they are to actually go out. But however it happens, it doesn't matter. It's the fact, like Mr. Herr said, I took a ride through here today about 11:30 through the center of town, and it was like it was, I don't even know what it was like. It was 1985 again. No traffic. It was sad to see the bar stools up and like Muffin House, the stools were up, so they weren't open. That's tough to see, and the ramifications that scare me more than the actual COVID-19 virus are the economic, how the economic fingers are going to reach into people's pockets. It's very scary to me, but it makes me sleep well at night knowing that you and your team and the emergency management team is right on top of it and giving us true cutting-edge factual data that is not speculative, not sensationalized, something that we can process and make our own decisions on. So,
And I'd say one of our greatest challenges was to overcome some of the poor diagnostic assessment of risk to residents in this community, and that poor assessment on we'll say the corporate side led to people just being misinformed, and that's at the end of the day, and I say this time and time again, all of the residents that are affected here, they went to work the last week of February and the first week of March with no intention on catching a virus.
Right.
And now it's our job as a community to support these people that are in quarantine.
Yep.
And to assist them with the issues about getting food and medication and just and then identifying any other potential people that might be at risk. They're still cycling in, and then secondly, this is the economic impact is something that we're really looking at, trying to figure out how can we support and set up structures to support these businesses in this time of need.
Yeah.
So that's really something that I'll be working with the chief to figure out, how we can build that into this the support structure that the chief has put into play.
Mr. Kamalo, our Board of Health is not the same Board of Health that just did Title V inspections just a few years ago. I will commend you on your hiring of Sean here and a lot of the other boards in town, departments in town. Sean, you've done a great job. And for someone that's been here for a long time in town, I appreciate all the hard work that you do and the experience that you bring to the place.
It's a good fit.
Don't get used to my compliments.
No.
It's a national emergency right now.
Yeah, no,
Once
no.
it goes back to normal, I'm gonna cut you right down.
I expect it. That's, you primed me for it, and
Yeah, we can edit this all out in post, but Mr. Nasrallah.
Yeah, I also want to thank you for all the work you've done. I think the information is critical to get out there, especially with the misinformation that has been floating and is still continuing to float around. So I think it's essential that we have someone who can communicate with our public and actually act as a liaison for medical care. I do have one question. If you could just kind of expand on the testing aspect. If somebody thinks they have it or they're curious, how does one, let's say they have the fever, how does one go about getting tested?
what we're, right now, our position is the best way to do that is A, contact your physician. You should have a conversation with them and then have them rule out that it's flu, the common cold, or any other respiratory illness. They should be able to do some quick tests. If those tests come up negative, and or if you can demonstrate that you've had close contact with a known case or a suspect case, or a case that had been approved for testing, they should give us a call. And then what we can do is what Casey does is she triages the patient or the case. She goes through their symptomology, their onset time. We go through all of their contacts, and then if we can find or identify potential close contacts, we will then, I'll create the case event, and then that helps, that cues them in line for testing. And then we can either work with the hospital or their physician to get approval. Sometimes we've had certain cases where I've just contacted the DPH directly and asked that someone be made a priority. And but the problem is right now is that there's a backlog in testing, and I would offer that I could probably resolve more than half of my cases if I could just get them tested. And I have one DPH priority case that it's in the notes that they approved the priority testing on Thursday, and it's Tuesday.
And they're still not tested.
Yeah. And but it's and that's why we really recommend if you have questions, we're fielding those questions every day, and then if we see that our case log or our case load is increasing, we have all of the school nurses that we've trained. They have all of their notes. They have all of the CDC talking sheets, and we I'll bring them in to help process that caseload. And that's one of the that was one of the best moves when we asked to close the schools. The first thing we did was we looked at our resource pool within the community and said, we have 7 fantastic nurses that we could bring in and put to work, and within half an hour, Casey and myself had them working on these case tracebacks and then helping them get into the DPH queue for testing.
Chair, can I ask another question?
You just did.
That's true. Second question beyond that question. Social distancing. So we're all using social distancing now, this term, like we've been using it our entire lives. I never heard of the term until 2 weeks ago.
I don't think
Never
it existed.
right? So it's all new to
It's
so many
new to
people.
everybody.
It came with COVID.
But yeah, now we're all so used to it. But I mentioned earlier, I went for a jog today by myself outside. The weather was just starting to clear. I was like, oh, I'll go out for a little jog. Social distancing is not me staying in my house 24/7, is it?
No.
I
No,
just-
but it's recognizing that we can accept that if you're spread apart sufficiently, the risk of you inhaling a droplet or having contact with droplets from a known or a case contact, the risk of bringing those in through inhalation, through getting them on your hands and then introducing them into your eyes, nose, or mouth is significantly less than if you're all packed in. And, then that's what drove, Mayor Walsh bananas on, Sunday night when he saw, 100 people in line. Because that's exactly what you don't want, because if all it took was one.
I mean, Hopkinton likes to be it's a fit community. We
Right.
kind of run around here because of a certain race that will be in September. So I just want to make sure it's okay to exercise, go for a walk, just do it, keeping people away from it, right?
And as the research comes out about how long the virus lasts on different surfaces, we can start evaluating, bringing back playgrounds. I mean, I'll be honest, I took my kids out to a playground in Framingham, and, but it was, you before you get into the truck, you wipe your hands. As soon as you get out of the truck and go into the house, you go directly to the bathroom and wash your hands. And it's, if you're not comfortable making and administering those instructions and verifying that everything's being followed through, there's a risk. And the problem is we just don't understand the transmission, how long it lasts on surfaces. And that's why they've asked to implement social distancing, because it is that one strategy that has been tested in other cases around the world. It has been demonstrated to reduce the risk of spread. And again, for the majority of us in the room, if we were to get infected, it'd be a nuisance. It might be a struggle to get through, but it's the seniors that we're solely doing this to protect the seniors, those that are immunocompromised in our population, and we owe it to them to just to make this sacrifice for them.
Okay.
So that's exactly what I was going to touch on is if your kids went out and got it and they touched their eyes and it's not generally speaking, it's not a life-threatening affliction to them.
Right.
If they took it and went to CVS with it on their hands before they wiped off and leaned on the counter and a senior came up there and did that, it very much could be life-threatening to a senior. So it is the elderly, it is the immunocompromised, the respiratory compromised that we're really focusing on, and that's lost on a lot of the translations where people simply think by doing some hand hygiene and coughing into their elbow that it's there to protect the kids. Well, it is to protect the kids to a point, but really it's to deter Mr. Deegan, are you okay over there? It's to stop the spread, and I think society really, it's lost that the focus really is to maintain the health and welfare of our people of elder ages.
I have friends that are nurses and doctors in Seattle, and it's a real struggle.
Yep.
And there's a lot of loss in that community for the seniors at
Yep.
was it Kirkwood or
Yeah.
Lakewood? So
Kirkland.
and Casey and I both say that's well, actually I'm not even going to go there.
Yeah, there you go. Perfect. All right. So that said, thank you very much. Chief, would you like to add anything? Or you don't have to if you don't want. If you'd
He's
like
been
to.
a great host.
We try not to say host in the healthcare world. But if, so the chief, you are one of personally one of my most, one of the people I look to reason and to, for factual stuff. So I would absolutely love it if you're interested in giving us a little idea of what's going on the emergency management aspect of this.
I can do it in less than 5, I promise.
Do it in 4.
All right. Yes, okay.
You're not gonna clean that?
Sean and I have so much alcohol on us from working in our
Mr.
office
Kamalo,
right now.
Mr. Kamalo, you noted that?
I did.
Okay.
All right.
I was gonna start talking about St. Patrick's Day.
Yeah.
Never mind.
You're on, chief. 4 minutes.
Okay. So to update you, it's a public health emergency. We've been working with the Board of Health. Quick kudos to Sean and Casey. Really outstanding effort. I've been working with Sean in a support fashion since the beginning of February. In March, we kicked in our support group, the emergency management group, and started to bring in a little support. You were there when the state of emergency triggered on the 10th, and by the 11th, we fully ramped up the Hopkins Emergency Management Team, which is 24 of our leaders in all the areas of running the town or supporting other groups. Along with the school nurses, I just want to mention, Sean touched on it, but it was really amazing their ability to ramp up and support the Board of Health and do the tracing that they did. I sat with them for 4 days, and I couldn't believe a group could just switch gears like that, and it just gave me great confidence in our system. So our goals in supporting Sean have been to make decisions based on fact and public health advice that he gives us. Sean is the expert and in charge with this information. We educate and inform people. We are trying to contain the virus and reduce risk. So priorities quickly is pushing out information. The hopkinton.gov//COVID-19 is a site that has all our information on it now. We ramped it up extensive on Friday, and our goal is to continue to improve the information going out to the community over the next few weeks. Some of the quick bases, Sean covered most. Be informed, there's also the state 211 information, and for our community, we just want you to be informed. That helps us. Also, just have your family plan, things I've talked about in the last couple of years. Emergency kits, we've worked with our seniors on emergency kits, and care for your neighbor is our preparedness for the community. Go meet your neighbor, call them, and see how you can help them. That's helps us focus on the real vulnerable people that are in need. Vulnerability, the quick assessment, Sean mentioned it, our vulnerable seniors, then our seniors, then our regular vulnerable population, and then the population. So we're just watching it in that order. Quick risk assessment for you is the person-to-person spread and the ramp up on our system eventually, potentially. Other areas that we are preparing for are legal issues. This really, the change in a state of emergency and some of the laws that you are seeing passed, the town manager's office has to work hard now to say, how do we do all of this right? And it's a challenge because some of this is new law. The continuity of operations with all our people, if this ramps up, is what we are preparing for right now. And I said future demand on system. That's my report.
Okay.
How'd I do?
So, you did fair. Thank you very much for that report, and it's nice to know that Hopkinton, for their emergency management, truly is as prepared as we can get. Nobody is 100% prepared for what's in front of us. Nobody. And it's never happened in my lifetime. It's never happened in anyone's lifetime in this room worldwide. The fact that we're getting facts and we're not getting points of view, that's huge, and it goes an awful long way to quell the hysteria that generally comes with things like this. So I really appreciate all that you and Sean and everyone on your team does. I love to hear you guys come up and do your presentation of what's going on, and then before you start, you thank your teams. That, to me, shows a very effective leadership is when you defer the credit and accept the blame. So seeing you guys do that, we know that we have the right people in place here now. And, you know, it's, when you get down to it, when you boil it down to brass tacks, our safety and livelihoods are in your hands. And there aren't two people that I trust more right now in the town to deliver that news and to make sure that the boat is going in as straight a fashion as it possibly can than you guys. So thank you very much.
Thank you.
Irfan?
Really just want to echo what Brendan said. It's good to know that we're in here. The town has got some some qualified people. We're in good hands, and keep it up.
Thank you.
Thank you.
Sure.
Through the chair, I really want to take this opportunity to highlight a few things. Number one, we want to thank Lisa Whitton,
Yes.
Chair of the Board of Health. She's been present, she's been active, her office has been exceptional. Secondly, I also want to share with the board that our communication with the legislative team has been very forward-looking and productive. We can reach Senate President Spilka, we can reach Representative Dyckman at any time, and they've kept the lines of communication very open. That is very helpful. And then thirdly, I can share with you that, yes, there's the technical side to the work that's being done. However, firsthand, here's what I'm experiencing. Commitment to public service. I see it in everybody here at Town Hall, and all the teams that are working on this. I echo the chief's words. The transition by the school nurses to join into this program was seamless. It was smooth. It was fascinating just watching. The decisions that are being made, here's what they speak to, at least for me. They speak to how this community takes seriously the responsibility for caring for each other. By seeing that are the values of responsibility, altruism. Thank you everybody for the support. The messages that we have sent out, they represent some significant change for the community. There's been understanding and cooperation from this community and support. Last but not least, I have received multiple offers for help from our wonderful and exceptional civic organizations, churches, non-profit organizations, and also from the private sector. I had one entity here in town that has worked very well with the town offer this afternoon to support our website activities. That's what Hopkinton Building Community Program is all about. Thank you.
Mr.
So has any of or have any of our first responders gotten sick, think they might be sick, concerned about being sick, any of that yet?
Nothing for fire, and I usually don't talk about the other agencies, so I don't know of any exposures. That goes through me, so.
How about our colleagues in the DPW? Can I put them in that as our first responders because they're on all the scenes too?
Yeah, so DPW is part of the emergency management team. I work with them to digest all of the changes that we do, everything from how they have the germ control program in social distancing, and they are studying how they can do their work different in the future. That's kind of the piece to keep working, and same internally with the fire department. We look at it's really scripted how we get information, how we not expose somebody knowing that information, the way we enter in a medical emergency to limit exposure. It helps us use our personnel right, use our equipment so that we don't exhaust it quickly, and so far so good.
Sean, are you aware of any cases in town with first responders? Possible cases?
Possible, but not related to anything related to their duty.
not related to their duty, but possible from other situations. Okay, fair enough. Just want to know. And then Sean, and Chief, maybe you can answer this too, and we've seen it in DC where they're talking July, August for this wave to kind of perhaps play out. Others are talking maybe even longer. You know, we've got some other, we got an email this week from our legislative team to Mr. Kamala's point, and they immediately were texting back and forth with me as one member about town meeting timelines and things like that I think we need to get into at some point here
We have
in this
it.
discussion.
We have it. It's an agenda item tonight.
Okay. Are we making that an agenda item?
Yes.
Got it, okay. All right, so we'll get to it then, I guess, but if you had to put a timeline on this thing, Sean, and I know that's a $28 million question, but you're one of a million really, you know, astute professionals in this situation. Could you even guess a timeline on this?
If you don't want to, I can just mention the word solar and he'll leave.
Just from an,
That may be the only power source.
just from an emergency management sense, so, picture what I told you in our document, we take the facts and we take what Sean's background is in public health, and we build a preparedness. So we're talking right now in weeks to the next month. There's really not a lot in that category that gets you there. So once you start talking past that, you're really starting to speculate, and it would be what you were, from our sources of information.
Yeah, okay.
I think that's really why our focus is on how we can support the businesses, you know, day to day, week to week, the residents day to day, week to week. Because I honestly, I think yes.
Okay, so it's all still speculation. Fair enough. And we just have to work with that.
Yep.
So when is this agenda item being inserted, sir?
So, it looks like it is, huh? Yeah, it is number 9. Now, if I could just take another moment, I usually like to fly through these meetings. To build on Mr. Kamalu's, the caring community, I put a thing, so the DPH and EOEA, Executive Office of Elder Affairs, where I work at my full-time job, we fall under the auspice of the EOEA. And at 8 o'clock last night, they put a regulation in that all nursing homes, assisted livings, they no longer can communally have dinner. They can't, they can't have meals in a community. They can't have communal activities, and they listed a whole bunch of other requirements. And by the way, this takes effect at midnight. So at 07 this morning, we no longer could have my 103 residents come out and have meals in the dining room, which was fine. We went up and knocked on the doors and we took care of that. The problem is, of my 103 or so residents that I have, 45 are dementia and mental health. So anybody who has cared for or been affected by someone with dementia or mental health, it's not that easy to go up and say, you guys got to stay in your room after breakfast, we'll grab you at lunch, we'll bring you lunch, and then we'll see you at supper. It just doesn't happen. So the whole premise of our facility is we're a social model. So we promote dementia patients and mental health patients to not seclude themselves in their rooms, to come out and deal with their dementia or deal with their depression or whatever anxiety issues they have. And they do it, and they build off each other's friendships. Therefore, those rooms don't have televisions in them. So today, just kind of brainstorming as I'm taking everybody's temperature as they walk into the building at 5:30 this morning, I put a thing on a Facebook group, which is it's like, I don't even know what it's called, but it's free for Hopkinton. So it's like a yard sale that people have that they don't charge anything for. So I said, my community we're in this predicament, and if anybody has a television that they're not using, would you please let me know? I'll come get it. I'll give you a tax write-off or a certificate for tax write-off. I have 28 32-inch or better televisions that I came around town today, strictly from Hopkinen residents, that they weren't using or that they could do without, that they donated, not lent, they donated to our facility. So that shows you what a caring community that we have. And despite what old Hopkinen versus New Hopkinen versus old Hopkinen, that shows you that the one, when things like this happen, the one community, it's amazing how everybody comes together. And one of the things I had put out is, you know, I haven't seen this level of people waving to each other as they go by since 9/11. And I was hoping I never had to see it since 9/11, but it really is, it's wonderful to see the town come into one family, so, you know, pretty much one family. And it warms your heart to know that we have the ability to have it there every day. It's not going to be there every day. Chief, back in the days of when I was lucky enough to be on the fire department for those couple of minutes, when we had a house fire or a serious accident on 495, all of our trivial stuff, who ate someone's sandwich, who ate the salad, who drank the soda, that went away, and we were a family. And that resonated with me in 9/11. That brought that back to me, and when we see it now, it brings it back. And it shows you that Hopkinen is much more than just a town with some property lines on it. It is a family, and it's to make lemonade out of lemons, which I'm not known to do. It's nice to see that out there. So sorry for taking an extended amount of time for that, but you know, historically through the years in town, it's noted that when things like this happen, it's nice to focus on the good as well as the bad. So thank you for bringing up that caring community, Mr. Kamala. All right, that's enough nice stuff. Consent agenda. The select board will consider approving the minutes of the 3/10/20 meeting. Section 2, Hopkinen Little League special temporary alcohol license, adult only fundraiser. Mr. Kamala, we are taking number 3 off of the agenda, or can we approve that in case something does happen and it does go off?
They did email today, withdrawing the application.
They withdrew it, okay. And that's it. So would anyone like to break any of these out?
Yeah, I want to break out 2.
Okay, I will entertain a motion to approve the remaining consent agenda items.
I move to approve the meeting minutes of the March 10, 2020 meeting.
Second.
Okay, any further discussion? Hearing none. All in favor? Aye. All opposed? Abstain? It carries. Mr. Herr?
So I have no issue with this Hopkinton Little League Special Temporary Alcohol License Adult Only Fundraiser, in that I support the Little League and was a coach and my kids played all that. It's all great. It's Friday, May 15th from 7 to 11 at St. John's Parish Hall. The likelihood of that happening, based on what we know today, I would suggest is pretty slim. I don't have a problem approving this, but that's certainly, approving this does not waive any regulations issued by the governor, the president, anybody else with respect to gatherings. You know, so I would approve this license for this fundraiser, but obviously there's a lot bigger issues these folks are going to have to make sure they make a sound decision on.
Sure.
I mean, I'm stating the very obvious here, but.
So, knowing Jeff Streak, who is the applicant, he was my son's Little League coach. He is absolutely one of the most pure people you'll ever meet in your life. There's no way that Jeff would ever think that our decision trumps, we'll say, the current state of our society. So we can go ahead, Mr. Kamala, we can go ahead and approve that pending the lifting of state of emergency and assuming that they will adhere to whatever current social distancing rules and regulations.
That are applicable at the time.
And
at the time of the event.
At the time of the event. And do I also hear?
I'll make that motion.
And do I also hear that you are waiving, okay with waiving their fee?
Yes.
Yes.
But I want to make sure that that social distancing protocol is in the motion and that what we approve it, so that other residents who aren't involved in Hopkinton Little League don't go, what the heck are they doing?
Right. Right. No, I think that's a great point. So we have a motion.
Second.
Okay, any further discussion? None? Okay, all in favor?
Aye.
All opposed, abstained, and carries, great.
Do we need a second motion for the waiver?
We put that in the first motion.
That was in the first
Yeah.
motion.
I mean, I heard that, but I thought maybe we.
You got that right, Elaine? Thank you.
Okay, thank you, Mr. Nasrullah. So we will go to the select, board and committee appointments. Select board will consider making an appointment to the Trail Coordination and Management Committee. Applicants have been received from Margie and Allison. There's one vacancy for an at-large member, and the appointment would go until 6/30 of '22. So we have two applicants for one opening. Is that correct?
That is correct, and through the chair, if the board is so inclined, I think we should continue this discussion.
I'm fine with that, yep.
Why is that?
Because they're not able to come and present themselves.
Excellent point.
Yep. So, on the next, for the 6 cultural council members, do we have 1, 2, 3, 4, 5, 6? So there's nobody that's to be excluded from this list, correct?
Correct.
So I will entertain a motion to, Mr. Nasrullah?
Yeah, I have a quick question. Why are we extending all the terms?
So when these members were appointed, they were either filling out an expired term, or the end date of the term was June 30th, regardless of the date they were appointed. But as it turns out, the statute requires members to have a 3-year term, and there are term limits, which makes it important that they serve a 3-year term. So this would extend the terms of these members so they serve a full year term from whenever they were appointed.
Okay.
So I guess
That makes perfect sense.
before I ask for a motion, why don't I put the agenda item out there? The select board will consider adjusting the terms previously voted for 6 cultural council members as follows, so that each member will serve a 3-year term to comply with statutory requirements. So now I would entertain a motion. Do we need a motion for this, Mr. Kamala?
Yes.
Yes, please.
Okay.
So I move to appoint Don Wolf, Andrea Wilk, Mina Kushuk, Amy Groves, Ilana Cassidy, and Darlene Hayes to the Trail Coordination and Management Committee to a term expiring June 30th, 2022.
Mr. Malo, it'd be a typo. Are we on the cultural council
Yes,
or the trails?
cultural council.
Cultural council.
So it's a typo? Okay. So it's for the cultural council?
To the Cultural Council, yes, thank you.
Okay. It is confusing. So I'll second that motion.
Okay, any further discussion? Hearing none. All in favor? Aye. All opposed, abstained, it carries. Notice to sell, Chapter 61A, 7 School Street. The Select Board will review a notice of intent to sell 7 School Street, which is the Mass General Law, Chapter 61A, Agricultural Tax Program, and upon sale would be removed from the program. The town's board and departments recommend the town not exercise its right of first refusal to acquire the property. The owner of a 10.97 acre property, which includes a single-family home, has received a bona fide offer in the amount of $833,910. So, Mr. Kamala, just curious for me, when we elect to not exercise our right of first refusal, this goes and it's a private sale. Are there monies, since it's in 61A, are there monies that come back to the town for past taxes that were deferred, or I've always heard that there are certain things there. I guess you would know.
Yes.
Yes, sir.
Those would be repaid to the town.
Good,
As part of the sale.
good, excellent. Board members, any other discussion on that?
So no one's inclined to buy our other colleagues on the various committees that would oversee something
Right.
like this, correct? Where is 7 School Street? Is that right?
So as you go down School Street, I don't know if you're familiar with that neighborhood since you live uptown. If you go down School Street towards Pond,
Yeah.
it is the 3rd house on your right before the end by Dr. Love's house.
Got it. Okay. So you're going down school
Yep.
on the right there, so it's in the woods there. Got
Coming from
Right
that
before.
neighborhood, you'd go down towards Pond
it. That
Street.
neighborhood.
It's across the street on the
I
right.
used to run from that neighborhood.
We all ran from that neighborhood.
And so nobody's interested in that, even though it ties up to the forest and stuff.
No interest.
It's on the opposite side of the forest. It's within the Winter Street Triangle.
Oh, okay, okay. All right, I'm fine.
Okay. So I will entertain a motion.
I move that the town not exercise its rights under Mass General Law, Chapter 61A, right of first refusal to acquire the property at 7 School Street.
Do we have a motion on that, Mr. Kamalo?
He just made it.
Yeah.
He, Mr. Hurd, he just made that motion,
It's at the bottom of it.
number 6, on your motion
Oh,
packet.
okay, just want to make sure we got the right, I'm not, yeah, just want to make sure we're good legally. Second.
Okay, any further discussion? Hearing none, all in favor?
Aye.
All opposed, abstain, that carries, thank you. Select Board FY 2021 Comprehensive Budget. The Select Board will receive from the Town Manager an update on the FY 21 Comprehensive Budget, which has now been submitted to the Appropriations Committee. Mr. Kamala.
Simple update, I confirm that statement.
Good.
Budget has now been transferred to the Appropriations Committee.
Good. So we had a meeting on Thursday with the school committee and had a discussion, and everyone was in agreement. So it looks like we're good to go, right?
Correct.
Good. So I will
Move on.
move on.
So, can I just jump in here for one quick second, please?
Is that through the chair?
Yeah.
Sure.
Chair, please.
Sure.
So we have put together a budget with our colleagues in the school committee. It is a substantial budget, recognizing the growth in the town of Hopkinton. It's not everything everybody wanted. Budgets, when they get to their final form or close to their final form, usually are just that. Not everyone, in fact, most people don't get everything they wanted. That's when you know you've got a pretty reasonable budget in hand, because you're just never going to take care of all the various factions. All that said, and we can proceed down through the Appropriations Committee path, and then it kind of comes back through this, the town manager's office to the board, and the board sends it to town meeting, and we kind of wrap it up at town meeting. All that said, if, like in 2008, 2009, when we had the financial crisis, and the budget changed dramatically overnight, if we have to do something like that for FY21, I would not hesitate to do that at the appropriate time. I want to go on record with the community and say, I supported the budget we submitted to appropriations. And God willing, all goes well, and we get through this very serious situation in our town, our state, and our country, on the planet, and we can continue on with an economic path, not only for Hopkinton, but for its residents, and then for the town, because if the residents get into a world of hurt here, we may have to adjust. I wouldn't hesitate changing that, by the time town meeting comes around, which I believe we're going to talk about next, because there's going to be more time between now and town meeting than we thought.
Yep, exactly right.
I just think it's really important for residents to understand, because I know there's a lot of work done on this, and there's a lot of growth in town, and there's a lot of money in play for all the various departments, and certainly our schools are a great asset for the community, and certainly a lot is there too for obvious reasons, and I support it. But I will also support making adjustments if we have to, if something really goes wrong economically and our residents start feeling the pain. We're just going to have to deal with that. We dealt with it in 2008, 2009. There was a year we had 0% increase year over year. The next year we had a 0.9% increase year over year, if I remember correctly. So we had done this in the past when our residents were hurting, and we should all just understand that is not what I would like to see happen. I don't want that at all. But we have to reserve the right as a community to still adjust if it becomes necessary.
I couldn't agree with Mr. Hurd anymore. I mean, I think he's absolutely correct. If we do need to come back, we have to come back. We're under some very, very unusual circumstances right now, and we have to keep that in the back of our mind that things change daily.
Yep.
Things change daily, and if we need to come back and take a look at this to help people in a time of crisis, then we will.
So I absolutely agree 100%, and I know that the two members that are not here tonight feel the exact same way about that. So, the select board, we report to the people. We will always do what's right for the town, and if we do have to relook at things, we will absolutely relook at things, no question. So now we're moving on. The 2020 annual town meeting warrant. Select board will review the draft 2020 annual town meeting warrant, including taking positions on warrant articles. So Mr. Kamala, how do you want to do this? Do you want to tell us a little bit about what's going on, and then we'll make our, we have 3 motions that we're going to make?
Correct.
So why don't you go ahead and do your thing, and then we'll do our thing, and
Yes, through the chair. As most of us will know, there has been a great deal of discussion regarding the impact of the COVID-19 virus on governance in general. And in terms of the town meeting, 2 questions have come up. There's the question that pertains to the annual town meeting. There's also the question that pertains to the election. And what we heard from town council is that in terms of the existing law, again, as I said, keep in the back of your mind the fact that there are some moving parts at the legislative level regarding governance, bills that may change this. However, in terms of the current legislation, town council opined that right now there is authority for the select board to postpone a town election, but only if it is called pursuant to the same warrant as a town meeting. Thankfully, here in Hopkinton, our practice is that we post the town election and the town meeting warrant together as one warrant. However, he said it is not clear whether this power can be exercised after the warrant is posted. Again, thankfully, we have not posted the warrant here in Hopkinton yet. Also, the town moderator can postpone a town meeting at any time before or during its session. However, that power is only limited to town meeting and not to the election. And then now looking forward in terms of the current discussions where you put together the existing legislation and what might be coming down the pike, here's what we know. There's an effort by the governor and the legislative team to address what happens with town meetings in general. And thus, given the existing legislation and the fact that we still don't have anything definitive relative to what the legislature will do relative to the bills that the governor put forward, the best path forward appears to be for the select board to postpone the annual town meeting to a date certain in June. Again, that June is taking advantage of the new legislation that was recently moved forward, as well as to authorize the town manager and town council to begin the process for obtaining special legislation to allow the annual town election to be postponed also. The governor has proposed legislation that would allow the annual town meeting to extend past June 30th and to allow the town to operating on a continuing budget resolution. We've seen this happen at the federal level. This is past the end of the fiscal year if a new annual budget has not been adopted. And what we have done is we've also learned that the Secretary of State has proposed legislation that would allow him to authorize the postponement of town elections. Since this legislation has been proposed before, town council is not sure about its prospects. It's been proposed before, was never adopted. Therefore, pursuing a special act seems to be the safest belt and suspenders approach for now. And to that end, town council offered a series of motions that the board could consider tonight.
So let me just try this, Mr. Chair, let me just try this from a slightly different angle in terms of what I've heard and seen with respect to local governance, and just interpret it a little bit based on what you just said.
Yep.
So there's a whirlwind of activity in Massachusetts and the United States, and certainly in Hopkinton, about all of this, starting with the fact that the pandemic is here. Beyond social distancing, beyond, you know, closing bars and restaurants, beyond all the things we're doing that everyone's talking about, legislative leaders in Boston and your elected officials here in Hopkinton have been given notice through the governor's office and others that there's legislation pending out there to delay annual town meetings all over Massachusetts this year, because annual town meetings generally draw more than 7 people. We have 7 people in the room right now, folks. We had 9, we're down to 7. The max in the state, based on the government, well, depends on who you talk to, we're trying to keep it under 10. Town meeting draws a lot more than that. So the governor sent out proposed legislation to change all this, to delay town meetings so that we didn't have people on top of each other or in close proximity a month or 2 out. Town meetings in Massachusetts generally start about now and go through end of May. That's typically when they are done. Specials are done in the fall, etc. But for us, being we do a town meeting generally the first Monday of May, that's been our, you know, practice. We're on the bubble of whether we would actually pull off a town meeting or not, depending on what happens with the virus. So we're trying to figure out, as I understand it, based on what this is all in the last 24 hours. I saw the email come from Representative Dykema. We're just trying to figure out what makes the most sense going forward, right? Is that what this is all about? And not to expose the residents of Hopkinton to a town meeting where we could be transmitting the virus, or to a town election where we could be transmitting the virus. So that's why this has come to be, based on the email I saw anyway. Is that another way of describing what you said?
Yes.
I don't know about the motions and stuff. I haven't looked at any of that. But.
Yeah. I think the general understanding is that each year we go to town meeting, and one of the, I think, most significant actions by that legislative body is approving the budget. So the budget that we are currently operating on ends June 30th, which therefore means if the town does not hold an annual town meeting as scheduled in May or before June 30th, come July 1, we have no budget to run the town. That's why part of the conversation is this continuing resolution, which will allow towns to hold the annual town meeting beyond June 30th and still have access to an approved budget process.
But if we do it in June, as long as we get it done by July 1, we don't have to have the budget approved by the Attorney General's office. Do we got article?
No.
Just other articles? Okay. So anytime in June, we can pull this off. We can set a date.
We're gonna.
And then if we can't make that date because it's still in crisis mode, we can just.
Yep.
What will we do then?
So, Mr. Deegan, building on that, so say we set a date of whatever date that we set. As long as so if we think at 45 days out from the date that we set, that we're still gonna be in an influx, can we at that point, before you post a warrant, come back and just simply do what we're gonna do again tonight? Or once the warrant's posted, are we kind of obliged to have that, the town meeting and the election?
So that kind of falls into what Norman had mentioned about some of the moving targets at the state level. This is obviously very much uncharted territory, and right now they're trying to work on legislation that would allow us to be able to do that. But currently, under the current law, if we were to go beyond the fiscal year without town meeting approving a budget, then we technically don't have the ability to function without a budget unless the state approves for us to basically, I know there was some discussion on allowing towns to continue operating under their current allocated amounts until, but again, it's a lot of speculation. It's up to the legislature to hash that out.
Okay.
But I think, so I guess the question I have is, can we kick the can further down later on? Is that, like, so 45 days prior to whatever day we pick today, if we still see it escalating, or we haven't seen it level off, can we then say we want to move it again? Or, I mean, I know it's a moving target.
Move it again into.
For the most part-
Into fiscal year
For the most
2021.
part, I'd have to defer to town council on that one, because this is, again, this is very complex section of municipal law where we're kind of, going out on pretty
Uncharted waters.
uncharted waters, and the opinion is a great one from Ray's office, but it's definitely going to be a new one.
In answer to your question, clearly I do agree with Corin. In terms of what could be possible tomorrow, we don't know. In terms of what the current law says, if you post the warrant, you have no ability to change that.
I'm sorry?
There's no ability to change
That's what I
it.
thought.
At least for the
Right.
election. For
So
the town
here-
meeting, like Norman had said, we can kind of we can kick the can down the road for so long on that,
Right.
but.
So we're fortunate at this point that we haven't posted the
Yeah,
warrant.
we're
So
not.
all we're doing is just gonna change the date. And for the people at home, I just did a quick check on the Metro West News. Natick has canceled their town meeting and their election, or postponed. Wellesley and Westboro also have postponed their election. So this is not groundbreaking stuff. This is the geographic norm to our area, and we're proactively following suit.
In fact, sorry, through the chair, to be clear on that point, my understanding is that in fact the towns that have cancelled their elections have had to go to court to do that.
That is true. Currently, because they don't have the situation that we have where they're not on the same warrant,
Yep.
they do in fact have to go and get a court order in order to move their election.
Okay.
I know Wellesley had to do that in a real tight time frame.
Yep.
So, and obviously, I'm sure the courts have granted those postponements because we are in a serious crisis here. I read the legislation that the governor has proposed, and the legislation is pretty clear. It's going to give an awful lot of flexibility to communities to figure out their finances 3 months from now, 6 months from now, whatever. There's a lot of flexibility, and if you go that far into it and you carry some extra money from this budget year into that budget year, but you actually spend more, then you can amortize it. You spend more over a 3-year period to wash it out. So there's all kinds of flexibility, recognizing that the tight time crunch we're under for a July 1 new fiscal year. So I'm very confident, not that I sit on Beacon Hill, that it's going to get worked out, and that future legislation is going to even make it easier for us. But to the point tonight, we have our own bylaws and we have state law in place today that allows us to put this thing out further. And then I think that flexibility down the road, Mr. Nasrullah, will be there too. That the legislation was really well written, I thought, just being a kind of municipal finance geek sometimes. And I'd be shocked if Massachusetts legislature did support it. But we don't have to worry about that right now. We can set a date further out. That's on the town meeting side. I don't understand what you said about the election piece of this, Mr. Kamala. I haven't looked at that, honestly.
So another interesting point, I was just texted from a viewer at home. The courts are closed right now. Yeah,
Kangaroo court right here is gonna be-
That is another slight complication, is all the courts started closing at the same time
Yeah.
that
Right.
government buildings started.
I haven't thought about the election side of this so much. What is that all about?
I think
Does
for
our
us,
election have to happen within 2 weeks of our town meeting?
I think it's in the
If I may,
bylaw,
currently,
yeah.
through the chair, our election is set in the bylaw, similar to our town meeting, where our town meeting is set to occur on the first Monday in May. Our election is set specifically to be after consecutive nights of town meeting, so it'll occur on the third Monday in May.
But if we can change the first Monday of May date, can we change the election date too?
So that's where our ability to act under the general laws supersedes the authorization in the bylaw. So because we're acting under the general laws to move this because of a public safety emergency, that gives us the ability to actually do this. And that's kind of where the bylaw can be superseded by the statute.
Look like your head's gonna explode.
Yeah, I'm still confused, but we've already had how many elections so far this year?
Quite a few.
I mean, if we cancel one, I guess we're not gonna have that one, so we can't say we had another one, right, because we canceled it, but, so,
So it would have to be postponed. Most cases that towns have done so, or they're postponing their elections. What they've been able to do with it is just have it so that, and I know there's some working with the legislature now to get this into its own statute, to have it so that anyone who's currently serving as an elected member of a board or committee would then continue doing so until the election can be held, and then the individual who wins that election would be sworn in to take in the role. Otherwise, the incumbent would continue to carry out their duties in that capacity until that day. So we would still have to have it. We couldn't just cancel it, but we'd have to just push it out, obviously, to where it's safe.
when I cancel it, that's not fair.
There's also some discussion as well that if we get to that point of trying, I know I've been talking with other clerks around the Commonwealth, and we're talking about how it would be good to see that we could have more openness on absentee ballots as well. I know there is some discussion from the Secretary's office and the legislation that he's proposing that they allow for early ballot by mail to try to decrease the amount of people that would be coming to the election hall, and try to encourage people to instead vote from home for their municipal elections just until the crisis is over.
So you're saying like to run the whole election on an absentee ballot? I mean,
Not entirely, we'd
early
still
voting?
have to allow people to come and vote in person if they chose to, which is one reason we want to make sure that the risk factor is
Yeah.
as low as possible when we do have the election.
Yeah, so we don't have to have it within 2 weeks of the town meeting.
I think it's
And it
within-
doesn't make a difference, obviously, it doesn't make a difference if it's within this fiscal year either.
It makes a minor difference. And I know that if we have debt exclusions, that could make a difference, because I believe there are potentially debt exclusion ballot questions. So that would push off any projects or borrowings. But I'm not the authority to speak to on that one.
So when somebody gets elected, like you got elected 2 years ago. We got elected on that May 15th, whatever it was, and we got sworn in that night or the next morning. So we were in office from that day until our term expires. When does our term expire? The day the next election is held for this particular seat, or July 1 of that following year? No, it's when the next person gets sworn in. So it's when the next election is held for this seat.
Correct.
For that seat.
So when the next election is held, that is when, and once the election is concluded and the voters have chosen either a new person or re-elected the sitting incumbent, then that is when their term has ended. Most of the laws do allow that anyone who's serving in a seat that is, in some cases, there's a situation where it'd be a failure to elect, but right now that's why they're trying to work at a law that would allow this to be like with most appointed seats, where they'll continue to serve in the role until a successor is appointed, at least in the case of an emergency. Otherwise, what would happen in a normal scenario if no action is taken in the state is typically it would be determined that there was a failure to elect if no one was elected. But again, that's more of it's a weird scenario, so it's more of a question for Ray on how that would have to play out.
I mean, I think about some of and I'm doing this on the fly here, we've got 2 school committee seats, we've got 1 seat on this board, we've got a Board of Health seat, I'm sure, we've got Parks and Rec, 1 or 2, Planning Board. So all those folks would stay in place until we got to this election?
Potentially.
At some point?
Okay.
I know some of those folks want to leave. Then what happens?
So they could choose to resign, in which case the rules for how vacancies on boards and committees until the next election would then be filled that way. So it would be that the remaining members of that board, following their resignation, the remaining members of the board would meet with the select board in order to vote on an applicant to serve until the election.
Got it.
In the case of the the select board, there's not really that same option, because it's designed that all other boards would be appointed by remaining members and your board. The select board is the one that has to have a special election if there's a vacancy for any reason.
So we're just talking about possibly a few months, maybe.
Yep.
I mean, we're not talking, I don't want to change the election process in
Nope.
Hopkinton. I don't want to change the
Nobody
will of
does.
the voters, none of that stuff.
This,
But I don't want people getting sick either, if we can control it. And I'm certain the state's going to do something about this piece of the puzzle too.
Yep.
So
this
what
would
is it
be
we
a
can do
temporary fix in order to
Yep.
just make sure that people are staying healthy and that we're not putting residents and voters at risk, and we're not putting election workers at risk.
Right.
So this is just kind of an all-around shore up the health aspect of it.
And anyone who doesn't understand that the extenuating circumstances are here, they're foolish. So,
And I thank Mr. Hurt for actually thinking these things out and saying them out loud, that it's not so simple that we just
Right.
postpone this. There's ramifications that go
Yep.
on down the line, and, we're only doing this because of the public safety factor.
right. There's no other motivation behind any of this. Despite what everyone on this little computer is gonna say in the next
Rubber
couple of
pain in the
days.
back. It's not worth doing unless you
Yeah.
absolutely have to.
Yeah.
So, we have a couple of motions here, Mr. Kamalo. Are we ready for those?
I believe if the,
Her?
I'm just curious, so you've heard this dialogue, and this election piece is still something I'm not clear about, but I'll defer to my colleagues and you. What is the path that you and town council think we need to look at right now?
I think the path is to exercise the board's authority as allowed by the current legislation. We all know that the situation is changing very quickly. We are hoping that the legislation that the governor filed will go through. We are hoping that the legislation that the secretary filed regarding elections will go through. And at that point, the board will make the necessary adjustments. But exactly, yeah. In terms of the,
So what does that mean for actions tonight then?
I think for actions tonight, the following, I think is implied. One, the board has to schedule an annual town meeting on a date certain.
Otherwise, we're on the hook for.
And that date has to be no later than June 30th.
That's based on current Massachusetts.
That's town meeting,
Exactly.
town meeting.
That's town
Yes.
meeting.
Yeah.
Yes, yeah, that's the town
That's in
meeting.
our motion.
Yes. And then, in terms of the election,
Should we do these separate?
yes, I was just going through the list of steps.
Okay.
You should do this separately. You want to do that now?
Yeah.
The motion?
So, Mr. Nasrullah, I will hear a motion on the town meeting.
I move pursuant to Massachusetts General Law, Chapter 39, Section 9, to delay the annual town meeting currently scheduled on Monday, May 4th, 2020 to June 29th, 2020.
I will second that with a question.
Okay, so I guess I can eliminate any further discussion. Mr. Hurt?
So June 29th, Monday, June 29th is the day before June 30th, which is the day that fiscal year ends, working inside the current Massachusetts general law. If town meeting goes beyond one night to 2 nights or 3 nights, when we pass the budget on Monday evening, assuming we get it passed on Monday evening, because it's an early article always, does that immediately then cover us starting July 1, which is on Wednesday the 1st?
In fact, through the chair, I was going to respectfully suggest that the board perhaps set June 22nd.
I would well, Mr. Deegan, do you have an answer to that, to Mr. Hurst's question?
Like,
I don't
we
care,
want
it doesn't matter to me one way or the other. And
Repeating the question, I apologize.
So my question is, we're talking June 29th. I support the motion in general, even maybe the date, I don't know. But if we are there on Monday the 29th and we got 15 other articles that take us through Wednesday the 1st, right? So we're into the new fiscal year. but the article for the budget passed Monday night, the 29th, which it typically would do. I don't foresee a snow day or anything like that, right? So, would that article become binding and allow us to fund the government on Wednesday, July 1, even though we're still technically inside town meeting?
I would say that because town meeting is still in session, there would be the chance for something like a motion for reconsideration. So parliamentary procedure might actually make it so that it could be non-binding. So I would kind of go with Norman's suggestion of moving it just a little bit earlier so we have some wiggle room.
So just for the people watching and listening, the reason that we were thinking June 29th was to give us as much time to be rid of the COVID-19 stuff, and if it bought us an extra week, that's great. Knowing that we may be back here, we're definitely going to be back here, I would say, before the warrant passes. I mean, before the warrant's posted, not passes, but before it's posted. We would much rather be in a category where we simply are where we are today than a week later have it be posted and then us having to go through a whole bunch more hoops to jump through. I'm absolutely fine with the 22nd, if you're good with the 22nd. You're good with the 22nd?
So you're amending it to the 22nd?
Yeah.
And I'll second that amendment to the 22nd.
Okay.
Mr. Kamal, the 22nd, that's what you're proposing, right?
Correct.
Is town council in on this at all? Is he,
Date is a local decision.
Yeah.
okay?
All right. So I'm good with all that. Everyone's good with all that? Any further discussion on just this town meeting warrant article? Okay. Hearing none. All in favor?
Aye.
All opposed? Abstentions? And it carries. Great. So, Mr. Nasrullah, I will entertain a motion based on the election.
Mr. Collins, did you want to say anything on the election before I make my motion?
Please go ahead. I think the issue has been covered adequately.
I move to authorize the town manager and town council to draft proposed special legislation to delay the town election currently scheduled for Monday, May 18, 2020, to a date later in the year, or if necessary to protect the public health and safety, to a date in the first 3 months of the next fiscal year.
So, Mr. Kamalo, there's a motion. Mr. Hurd, should we second it before we?
I'll second it, but we'll
Okay.
talk about it.
Yeah.
So, based on the motion, I was the one that suggested that we scratch from the second to last sentence, the fiscal year. And only because if our town meeting is on June 22nd, there's probably a good chance we're not going to get the election in on the fiscal year. So this basically says, we authorize you and town council to draft a proposed special legislation for somewhere down the line during the year. But if we need to add that fiscal on that second to last line, if we need to add fiscal to year, I am personally fine with that. Does it make a difference?
It doesn't make a difference. I think we should have it, just in case.
All right, so we have a motion and a second. Mr. Hurd?
So just to understand this piece of it, and I didn't have I was thinking town meeting, never thought about this side of it. So we're talking about moving to authorize the town manager and town council to draft proposed special legislation that would go to the legislature. And the legislature would have to take that up about little old Hopkinton, or all the other stuff's going on, said word, and get this passed, or we're in a little bit of a bind if they don't pass this, under current Mass General law. So my only question is, if we vote this, we're basically canceling the May 18th election, in effect, correct?
Postponing.
Yeah, currently we're to a later date, because we're voting to a later date, in the fiscal year where necessary public safety and health, in the first 3 months of the next fiscal year. But if we pass this and the general court doesn't take this up,
and the governor doesn't sign this, toot sweet, we're kind of a ship without a rudder here. Is that a fair assessment? I'm not discrediting the motion, I'm just trying to understand what we're getting ourselves into.
That's a fair concern. I think we're very fortunate that we have a really great legislative team as well that has worked very hard in the past when the town has proposed special legislation, which has not been uncommon. They have worked very closely with us to ensure that that special legislation gets through the general court, gets signed off by the governor, and gets back to us to help the residents of Hopkinton. In this situation, we have something that is a public health emergency, and I have no doubt that our team and the general court would push to make sure that we have all the tools in our tool chest available to ensure public safety.
That makes me feel very good, because you're right. Representative Dykema and Senate President Spilka, it was a crazy response, and she's texting me at 10 o'clock the other night, and she's been on Channel 5 and everything else for 3 hours, talking about the town manager, the meeting side of this thing. And this is just really a backup position to what we think is coming through the governor's proposed bill and the Secretary of State's proposed bill about elections and town meeting in general this year. All this could be for naught if the state comes out and says, here's what's going to happen, and we're all going to do it this way going forward. So this is really a backup plan. Would you agree with that?
I would say essentially.
Essentially. Yeah.
So for the members of the public, because this is going to draw some questions, we moved the town meeting to June 22nd. And as a result of that, we're now looking to get the legislature to allow the town to move the town election to a date later than June 22nd, actually within 3 months of the new fiscal year, so it could be July, August, September. So it could go to September sometime, by the end of September. I mean, we got that September primary coming up. I know you're not a big fan of 2 ballots, but all hell's broken loose here, right? So you might have to put up with that. So we can still get it done, you know, and this, I think it's really important for the residents to understand, we're trying to find a way to get it done and get it done safely. 3 months is not gonna, we're not gonna reinvent the town in 3 months, depending on who all sits in what boards for the rest of the 3 months. Okay, but I sure hope the Secretary of State comes through with something else.
Yeah.
This makes me nervous.
Yep.
He has proposed the same legislation every session since 2013.
We've never had a crisis like this.
Correct, which is why there's some speculation that it could turn out differently than the past few times that he has submitted it, but we can only wait and see on that.
We'll
If that
see.
doesn't happen, then we're covered here, because then the court's gonna have to do something.
Right.
Yeah.
The legislature.
Yep.
Okay.
Good, so we have a motion, it is seconded. Mr. Nastula, anything?
No.
No? Good. All right, no further discussion. All in favor?
Aye.
All opposed? Carries. And Mr. Nasrullah, the third motion.
I move to authorize the town manager and town council to submit said proposed special legislation to the office of the governor for submission to the general court on behalf of the town, and further to authorize the town manager and town council to work with the office of the governor and any other elected or appointed officials with respect to that submission and in furtherance of the general court's consideration and passage of said proposed special legislation.
So that motion basically addresses what I was just whining
Yeah.
about. I didn't know it was there.
Second.
Second.
Any further discussion? Hearing none. All in favor?
Aye.
All opposed? Abstain? It carries. Thank you. Thank you, Mr. Deegan.
So, Mr. Deegan, I think we should probably be ready for our colleagues that are sitting on these current boards and committees, or boards anyway, the elected positions in town, who this will affect now. It will affect them now, what their options are, and let's make sure we're clear on if they need to step off, or for whatever reason they can step off. You know, we got to figure all that out. We should reach out to those people.
I'll work closely with
Yeah.
town council, town manager's office, and those affected to ensure that they know what their options are, and and we can support them in making the option that's best for them.
And just to reiterate, the people that are leaving the boards I have a feeling that they're a very dedicated group, and I think that anybody, I realize it now after having served on the town for a little bit, anybody who does throw their hat in the ring to serve is not going to simply just say, you know what, I'm all set after May, I'm out. Hopefully they won't do that. I can't foresee anybody doing that. I think everybody is very dedicated and driven for their cause, and my thought is that this will be a non-issue. I hope is that.
I agree 100%. I have had the chance to talk with folks as they're taking out nomination papers,
Yeah.
and we have people who are very interested in supporting their town, and I don't think they're going to let this stop them.
Right. Awesome.
Thank
Thank you.
very much.
Mr. Kamalo, town manager's report.
Quickly, Main Street. As you know, the 100% design is now in the hands of Mass DOT. We have since received comments from Mass DOT. Our consultants are responding to those comments as we speak. We've also been meeting with the Chamber of Commerce to apprise the chamber members of the schedule. In our most recent meeting with the chamber, we in fact issued a press release after that meeting, which was shared with the public. Moving on, I'm also requesting the board to accept the staff recommendation appointing or identifying I always want to call the name correctly, Baypath as the Baypath Humane Society of Hopkinton as the winning bid for the leasing of land for construction and operation of an animal shelter at Fort Street, 66 Fort Street here in Hopkinton.
Excellent. A wonderful organization. Is that it?
That's it. So I'll accept any questions on the...
Yes, one quick one. With the marathon being delayed, I know we had a goal of shovel ready for the Main Street corridor day after the marathon.
Yes.
Are we planning on digging it up and and then covering up for the race, or?
We haven't, no, we haven't. It was not based on the date, it was the day of the marathon.
Yeah.
Mr. Kamala was very quick
Okay.
Call the chair.
to point that out, that when the marathon was postponed, one of his goals were directed to be, my only thought to that is, I do believe we do their employee reviews before September 14th, so at that point, we could possibly still get him on that, so.
I think I'll have a strong position on that issue.
Well, we can't have people a month from now doing, I mean, there's no point
Yeah.
in doing that right now.
Yeah.
Counter everything we're working on tonight.
Do you think that the project's gonna be shovel-ready before September 14th?
No, in fact, I think
It
the
hasn't
issue,
even gone out to bid, has it?
yeah, in fact, the issue, it will go, the intention is to advertise the project mid-June. However, because of the switch, the postponement of the marathon, clearly, we can't do any work on the road before September 30th.
Why not? Seriously, why not?
I
When a contractor leaves at night, contrary to what our Cedar Street Route 85 looks like,
Yeah,
our
exactly.
contractor should leave that road in dynamite, perfectly flat shape, ready to go, like it's not even there. That's what the contractor
Love your
should be.
theory.
I have a
Great theory.
I have a famous saying I always share here at Town Hall. I heard it from Elaine when we were doing the work up on the 3rd floor. Went up there, we were expecting a contractor to do work, and there was no contractor. Come back the next day, no contractor. Third day, look up at Elaine. I say, Elaine, what's happening here? He says, no one. They are contractors. They show up, they don't show up.
Nothing to
So,
say, and there's
imagine
nothing
you
to
dig up-
say, I
yeah.
don't believe there's anything that says that they have to start there. They could probably start down there, which isn't affected by the marathon. 80,
I think
Buses
the
come
idea of
down that
gathering
way.
people anytime,
Yeah.
you know, for something like that, which is a bit of a,
10 people.
it's a little bit of a party,
Yeah.
we could hold off on. But, I just want to be clear, we have submitted 100% plan, so the design is done. Are there any changes to the design forthcoming? there was some discussion about the Marathon Way situation with one of the statues or something like that, one of the war memorials.
Yes, specifically, there was a very forward-looking comment from the veterans through Mike Shepard. Namely, if there was an opportunity to create perhaps a viewing area for the memorial, and in place of that, to do that, we are replacing parking with an expanded green space in front of the memorial.
Good.
I think that makes all the sense in the world for the veterans. Any other change is still pending, or is the 100% kind of like lock this thing down?
At this point, we're talking lockdown. We're moving
That term
towards.
now,
Yeah.
sorry.
Easy on that term.
Yeah, I mean, we're moving towards developing the plans for the bid specifications.
Okay.
Excellent.
Yeah.
Mr. Kamal, can I ask one question on the town manager's report? Based on everything that's going on with social distancing, can you give us a status of what we're doing at the town hall as far as what offices are open and closed and how they're doing business? And just at 10,000 feet, I know that somebody had called me today and asked if the town hall was open, so.
Yeah. Town hall, the library, senior center, DPW, park and rec offices are closed to public access.
Mm-hmm.
Town employees are still coming to work, and we have posted messages to that effect, identifying phones, email, as ways that people can contact us to conduct business. As you know, this community has invested substantially over the past years in allowing transactions to be conducted online. So we are pushing forth that concept. We also realize that most of our business pertains to inspections. We'll continue to do some of the critical inspections, though with very clear guidelines in terms of what our employees could do to protect both the customers as well as our staff. And we have set this up to run until next Monday, pending what happens at the state level.
Yep.
Yeah.
Good. So, to everybody at home, check the website, and if you have any questions, you can call our employees are here. It's just that the doors are locked for the public to get in because we want to keep our employees safe, just like we want to keep our residents safe. So, feel free to check in often to the website. There'll be very up-to-date updates, and we'll go from there.
Mr. Chair, Mr. Kamalo, I received yesterday two excise tax bills for this year. Today, the federal government announced that there will be a 90-day extension on filing your tax returns. So if you owe the federal government, you won't be having to pay it until May, June, July 15th. As I understand it, I don't know if that's passed yet, but that's what they're proposing. Is there any intention of the town of Hopkinton to delay the payment of any real estate taxes, excise taxes, water bills, etc.?
At this point, we're still working on the deadlines that were set by the respective departments and boards for those payments. However, we're also continuing our conversations with our legislative teams to see if the state is going to provide some relief that the towns can utilize.
So the answer to the question then is at this time, no, please forward your payments, when due. Because a lot of those like demand charges of $10 or whatever it is, those are state law regulated, correct?
Correct.
Okay, so just an FYI, you still have to conduct the business, but maybe there's some relief coming down the road, but I wouldn't bank on that right now.
Mr. Kamala, for the lease on the animal shelter, do we need a motion on that?
Yes, please.
Okay.
I move that the select board vote to approve of the award of the lease of a portion of the property located at 66 Fruit Street to the Bay Path Humane Society of Hopkinton, subject to the successful negotiation of a lease between the town and the Bay Path Humane Society of Hopkinton, and to authorize the town manager to negotiate a lease with the Bay Path Humane Society of Hopkinton with the assistance of the town council.
Second.
Second.
All right. Any further discussion? Hearing none. All in favor?
Aye.
All opposed, abstained, it carries. Liaison reports, board invitees. Mr. Nasrullah.
I have none.
Mr. Hurd.
Nothing.
I have none. Future board agenda items. Mr. Hurd.
Future town meeting and future town election, obviously, it's something I think we should be updating on a regular basis. going
Yes.
forward.
Absolutely.
And also,
Like,
goes without saying, it was the Board of Health updates on the COVID-19 scare. Mr. Nasrullah, anything else? So you are going to be my Catino, and I will, this is my favorite motion too.
I move that we adjourn.
We have a second.
second.
Ah, that's great. Any further discussion? Hearing none. All in favor? Aye. All opposed, abstained, carries. Thank you. Thank you, everybody. Stay safe out there. Cough at your elbow and wash your hands. Thank you. Good night.
Elbow bump to all.